For 2 years, elective surgery has been on again and off again. We all know our hospitals are doing the best they can. But when you're in pain or worried about your health, the last thing you want to be told is you have to wait. The stories you're about to hear will make you question how long our patients can survive in limbo.
Every day I wake up and think, is today my last day? Is today going to be it? Is it going to rupture?
Helen Theo considers herself lucky.
As I go to bed at night and I feel a little pinch in my head and I think, am I going to have a stroke tonight? Am I going to wake up in the morning?
The Sydney mother of two is living with a ticking time bomb, a brain aneurysm that's doubled in size in the past 12 months. Surgeons were supposed to operate next week to stop it growing.
And actually today I was meant to be going for my pre-admission to start my blood thinners and get ready for the surgery, and yeah, it's all cancelled now. So
when they called you, what did she say?
That unfortunately due to the new COVID restrictions, all elective surgery has been cancelled. The brain aneurysm.
With the risk of the clot rupturing, Helen is understandably anxious.
Yeah, I thought my surgery, being brain surgery, would be priority surgery and not elective, so that was quite of a shock.
And like many, she has no idea when her surgery will be rescheduled.
With it the way that it is and doctors know that it's growing, I mean, what are the risks?
If it ruptures, death is the worst case scenario, or paralysis, stroke, obviously. So there's a whole list of things that could happen to me while I'm waiting.
Elective surgery is not considered urgent, but for patients waiting in line for what could be a life-changing operation, it certainly doesn't feel that way. And now with COVID once again postponing thousands of surgeries across Australia every day, many are at breaking point.
It affects my sleep, my mental health. So that's from the original surgery.
Rhiannon has been battling to fix botched bunion surgery she had in September 2020.
The metal screw got put in the wrong spot, so subsequently I've had 3 surgeries in total.
Still fighting an infection in her foot, the Geelong resident was supposed to have it fixed at the end of the month with a new surgeon.
Now, because elective surgery's been cancelled, it can't go ahead, so I'll have to stay on antibiotics and pain relief for a lot longer.
Rhiannon has been told it could be March before her foot will hopefully be fixed. That's despite paying for private health insurance.
That's what I pay, $125 a fortnight for top private health cover. You would think that it shouldn't be an issue. The health system's buckling. I feel really let down.
Can's grandfather, Don, was told his colonoscopy was cancelled just 90 minutes before the procedure.
So I called back to make sure it wasn't a crank call or misinformation or something, because I'd gone through a 4-day preparation process. And she said no, because of new COVID protocol.
Don feels like his health is at risk the longer the procedure is delayed.
It's a diagnostic test, and it shouldn't be just randomly considered elective, because there's nothing elective about it.
Be put on the back burner,
Ellen has painful kidney stones.
I'm in pain nearly 24/7, and I can't keep going to the each week and saying, oh yeah, you're on the list. I don't want to be on the list. I want my quality of life back.
Her surgery is classed as a Category 3. In the public system, that comes with at least a 12-month wait outside of COVID times.
Now, I understand the seriousness of COVID, but they need to work out another solution where to put the COVID patients that other people can have surgery.
Elective surgery is currently on hold in New South Wales, Victoria and Queensland. South Australia is only allowing limited operations, while in WA, a ban is expected to come into force within 6 weeks. Around the rest of the country, authorities are not ruling it out.
It's kind of like playing the fiddle while Rome burns.
Tim Blofield is a surgical nurse at one of Sydney's biggest hospitals. He can only talk to us as a union member, but is speaking out because Tim says it's not just elective surgery being canned.
We shouldn't be cancelling heart surgery because there's no ICU beds. That shouldn't be the normal, and it's happening with time-critical procedures. If you have liver cancer and you need that cancer taken out, you need that cancer taken out. But if we don't have the facilities for you post-operatively, we can't do that procedure.
So are you saying people's lives are having to be put at risk?
I think when a system under this much stress is yes, their lives are being put at risk.
But health bureaucrats are bickering over a solution. In Queensland, the Medical Association's Professor Chris Perry.
This is the right thing to do to cut back elective surgery. And if it means people are going to take painkillers for their sore hip for another 6 weeks, so be it.
Across the border in New South Wales, the AMA's Dr Andrew Zushman.
It seems as though the governments are using elective surgery as a tap that they're turning on and off while we ride the wave of COVID.
So when the politicians get up and say, everything's fine, we're coping, what do you say?
Yeah, I'm just baffled. It's like absolutely not the case. Like, we have people who are sick, like actually sick, in waiting rooms for like 15 to 20 hours. So it's running fine. No, it's not.
Do you ever just want to give up?
If you don't help keep it up, then the system will just fail faster. People rely on this. Everyone wants to know that if they get sick, there is something there to catch them.
Our hearts go out to those healthcare workers and the patients waiting, of course, too. Imagine how frustrated they'd be to know that much of this chaos could have been avoided. Well, Dr Ian Norton, Emergency Disaster Management Specialist and founder of Respond Global, says he urged leaders to stockpile our supplies of rapid antigen tests 6 months ago. He joins me now from Noosa. Doctor, thank you very much for your time. We appreciate it. You say you raised the alarm back in August. Who exactly did you warn and what response did you get?
At that stage, we'd already had the Delta outbreak start in New South Wales, and certainly we'd had some great interaction with the Commonwealth Government, and their stockpile had started looking at particularly aged care. We had been involved the year before in Victoria with a terrible aged care crisis, the 165 different facilities all infected in August, September of 2020. And we had great interaction with Minister Hunt and the federal government, and they put together a stockpile, which was the National Medical Stockpile for rapid antigen tests, to be used in a surveillance system to try and prevent COVID staff and contractors and visitors coming into aged care in Sydney during that terrible outbreak in the middle of last year. I then took the same sort of ideas to various ministers of health and CHO, chief health officers around the country, and at the state level, they weren't interested.
So you're saying it's the state leaders, our premiers, essentially, that ignored this warning that you issued 6 months ago?
We were interacting with each state at a time and saying, really what we're doing here in aged care, we need to look at for the health system, particularly for ambulance workers, helicopter pilots and others who do the rescue services, the day-to-day work in hospitals. We feel at a state level, you should look at having at least some of a rapid antigen test ready to start screening your staff in case we ever have another wave like's just occurred in Sydney. We didn't get a reaction. We were already using it in the private sector, particularly in meat and distribution centres, but not at the state level.
Did state premiers give you an explanation as to why they weren't acting on this advice that you were providing?
Many were actually quite receptive, and they said, no, this sounds to make sense. We need to check this out. They would then go back to the health bureaucracy in their own state, and then the answer would come back, no, we've been advised we don't need it right now.
So red tape, bureaucracy, that's what's got us to this point, you're saying, where we are at a critical shortage of rapid antigen tests, which we knew all along were going to be the workhorse of our testing system.
We could see this happening in the UK, the US and Europe, and what's good about this particular test is it starts to kick in when we get high rates of transmission, and it starts to be useful to defend our PCR tests and generally workers getting back to work. We knew it could happen, and I felt in a way that there wasn't an appreciation that we should just prepare for the worst and hope for the best. There wasn't a preparedness approach, perhaps because people were just too busy with what was in front of them, maybe.
So we've been caught on the back foot. You're now working, Doctor, with supply chain industries who have huge parts of the workforce, as we know, in isolation right now. What impact is this shortage of rapid tests having on businesses around the country?
It's affecting all sorts of groups. We've certainly been working with the meat industry, the Australian Meat Processing Corporation, and many of their members, because of course abattoirs were so badly affected early on. We've been involved actually in that safety of food supply issue with the World Health Organization many months before. In fact, in the middle of 2020, we've been asked to look at it from the global side, how to make sure that food security in developing countries could be protected in case they had large outbreaks. We then got involved here in Australia, and so the meat and food processing industry was one of our first ports of call. Then other distribution centers, couriers, even groups who are involved directly in the vaccine rollout. If we lose those workers, then we lose our vaccine rollout.
Yeah, huge parts of the business community have been crippled as a result of this lack of rapid tests. The Prime Minister has announced, or did announce last week, that the government will cover the cost of rapid tests for concession card holders. Should they be free for all of us?
Well, I think just blanket mailing out to everybody may not be the most strategic use of these tests. There's still a finite resource. Remembering Omicron has now affected the rest of the world. There's a very, very little on the global market. We had our chance to, I suppose, stockpile early. We've lost that chance. Now we're fighting with huge orders from other countries. The US, Mr. Biden already announced 500 million tests being bought for his country, and we're competing in that same market. But instead of buying in, we won't get access like that. Sorry, go ahead.
Well, I was just going to say, in that very competitive market that you mentioned, the federal government has secured another 70 million rapid tests to be rolled out over the next month or two here in Australia. But is it too little, too late for us?
It's not probably going to be enough for what we're really looking for, which is a blanket approach for essential workers first and foremost, making sure those who are dealing with the vulnerable in aged care and disability service, for example, and then looking at critical service industries, and then making sure small businesses can actually continue. They've struggled so much in the last 2 years. How are we going to actually have a small shop that serves coffee, for example? They've got 3 employees. They need to have at least a small amount of access to tests. So if one of those goes positive, or even their family member is positive, they need to be able to check that family member and be safe then to come back to work.
Well, you shed a lot of light, Doctor, on how we got ourselves into this mess in the first place. We appreciate your time very much and your insights. Thank you very much for joining us. Dr. Ian Norton, thank you.